Good afternoon. Today I'm going to talk about the advantages of using laparoscopy in various gynecological procedures. Surgical methods have tremendously improved over time. Newer, safer, and better techniques have made the quality of life of the surgical patient much better and reduced the morbidity at the same time. Laparoscopy is one such revolution which has basically improved the way we treat the gynecological patient. It is a standard form of surgery in which almost all procedures which are done by the abdominal method can be done. So what is laparoscopy? Laparoscopy is a surgery in which basically we enter the abdomen by means of 1 centimeter incision on the abdomen. So a tool, that is a laparoscope, goes inside to that 1 centimeter incision, and it has a video camera at one end and a light tip at the other. So this helps in seeing the abdominal cavity as a whole and deciphering what is wrong with the various organs placed there. At the same time, we use 5 mm ports to insert various instruments inside the abdomen, and once the instruments go in, they help in basically treating the abnormality which is present in the abdomen. So in gynecological procedures, what are the procedures that we can do by laparoscopy? Almost all procedures, laparoscopy has been standardized for almost all procedures now, but routinely we are performing laparoscopic tubal surgeries, laparoscopic ovarian cyst surgeries, laparoscopic fibroid removals, laparoscopic uterus removals, that is called hysterectomies, and also in case of an ectopic pregnancy, removal of the abnormal tube by laparoscopy. Then also all the operative and therapeutic procedures in infertility patients are done all with laparoscopy. They offer the advantage of minimal touching of the tissues, and therefore because of the minimal access or minimal touching of the tissues, we are able to give them a better outcome. Then we can also go for tubal recanalizations by laparoscopy now, and also surgeries like tubal ligations are possible by means of a laparoscopy. All major gynecological cancers, apart from a few, can be dealt with laparoscopically with the same outcomes as the abdominal surgeries. So it basically depends upon the expertise of the operating doctor. If they are well versed with laparoscopy, it has a number of advantages. So coming on to the advantages of laparoscopic surgery. So one of the major advantages is that through small scars we are entering the abdomen, as a result of which the postoperative pain and the postoperative mobility is improved. So pain is less and we are mobile earlier. So this helps in reducing the morbidity of the patient, and definitely the surgical outcomes are better. We have seen that these patients have less of postoperative infections because the wounds are very small, and also these patients have almost minimal scars on the abdomen because we are entering to such small incisions that patients definitely after a week or 10 days we find that the scars are really not visible. So somebody who is very much worried about their cosmetic appearance as well, they can have a lot of advantage, like young girls have a lot of advantage of going in for a laparoscopic surgery. The other advantages in case of infertility patients, there will be minimal handling of tissues and we will not be touching the other organs. So as a result of which the postoperative adhesion formations, postoperative infection rates, they are all reduced because of laparoscopic surgery, and as a result of which the outcomes, the final outcomes of such patients are much better. So all the fertility enhancing surgeries that we do are done laparoscopically. So by this small awareness video, I just want to convey that all the myths that laparoscopic surgeries lead to, will not do the surgery complete, or some organs or tissues will be left inside, all these are all myths. We should just come out of it, because this is a surgical technique which is now becoming the standard for all operative procedures, not only gynecology but other surgical procedures like hernia surgeries, bowel surgeries, gallbladder surgeries. So, and it depends upon the expertise of the surgeon and not on the procedure itself. So all these things that patients think, most of the times they come and tell us that we want to go in for an open surgery because we know that the complete surgery will not be possible by means of a laparoscopic surgery. That is not true. These are all uncalled for, and these are, I would say that these are just hearsay. So if it is done in the right hands, in the right way, it has a lot of advantages, and in fact it has now become the standard of care in most countries. Thank you.